All right, so are you ready to really get into some potential changes in U.S. healthcare? Because today we're deep diving into Dr. Eric Berg's YouTube video. Here's my 2 cents, making America healthy again. It's super relevant right now with all this talk about RFK Jr. possibly being our next HHS secretary.
Yeah, for sure. Dr. Berg's ideas are getting a lot of attention lately, especially since RFK Jr. has been so vocal about tackling chronic disease.
Totally. And RFK Jr. is already getting pushback from some pretty big industries like
Wow.
big food, big pharma, all that. Makes you think maybe he's onto something, right?
It really does. I mean, Dr. Berg's video kind of boils down to this one question. Is our healthcare system really about health? Or is it more about profit?
That's a big one for sure. And to get us started, Dr. Berg throws out this crazy statistic. The U.S. spends over $4.1 trillion every single year on healthcare.
Whoa.
Trillion with a T.
Yeah, that's a crazy amount of money. And for all that spending, we still end up with some of the worst health outcomes in the developed world.
Right. It's like, if we're spending that much money, shouldn't we be the healthiest country on earth? Like, where's all that money going? Is it being used right?
Yeah, you have to wonder about the system's priorities. And that's where Dr. Berg comes in with what he calls his 2 cents. He lays out some pretty big solutions that could maybe turn things around.
Okay, so let's hear it. What are some of these solutions? One that really stood out to me was this thing he calls institutional food.
Right. He's talking about the food they serve in places like hospitals, schools, and even prisons. You'd think they'd be all about nutritious meals, right? But according to Dr. Berg, it's not always the case.
He even shared his own story after having surgery. He said the hospital food was, well, not that great. Have you ever had an experience like that? I know I have. Like, they're not even trying.
I know what you mean. And it's not just like one person's story. Dr. Berg also interviewed this person who runs assisted living homes, and they actually prioritize healthy, good-tasting food. And you know what the biggest obstacle was? Bureaucracy. It's amazing how hard it is to just give people good food.
You're telling me it just doesn't make sense? Like, you think nutritious food would be a no-brainer, especially in hospitals where people are recovering?
Totally. It shows just how disconnected we are between knowing that nutrition is important and actually putting it into practice.
Okay. So are you ready for another one of Dr. Berg's ideas? Subsidies. Now, I know subsidies don't sound that exciting, but trust me, this is where it gets interesting.
Okay, I'm listening.
So Dr. Berg really explains how agricultural subsidies are currently set up to favor large-scale production of things like corn, soy, and wheat. And you know what? A lot of that subsidized corn ends up in junk food.
Seriously. So our tax dollars are basically helping to create the obesity epidemic.
Basically.
Yeah.
Think about corn syrup, cornstarch, all those ingredients that are in like every processed food. And get this, corn subsidies alone are estimated to be a crazy $600 billion. That's billion with a B.
Wow, $600 billion. What if we took some of that money and gave it to farmers growing real nutrient-rich food? Imagine how much healthier we could be.
Right. Shifting those subsidies could totally change our whole food system and make healthy food available to everyone. Okay, so we've talked about institutional food and subsidies. What else does Dr. Berg have for us?
Well, he talks about something called the generally recognized as safe loophole. You'd think GRAS means something's been tested and is safe.
Of course. That's what it sounds like.
But here's the thing. Manufacturers can actually decide themselves if their ingredients are GRAS. It's like food companies get to decide if their own stuff is safe. That's the GRAS loophole.
No way. So there's no one checking or anything?
Not always. And the crazy thing is, a lot of things that are banned now, things we know are bad, were once considered GRAS. Like lead, DDT, mercury. It makes you think, what are we eating now that's going to be dangerous later?
Yeah, that's a scary thought. Like, we're all in this big experiment and we don't even know it.
It definitely makes you wonder about how transparent our food system really is and who's really looking out for us, you know?
All right, so we've got institutional food subsidies and the GRAS loophole, and we're just getting started. Dr. Berg also talks about food fortification, which at first sounds good, right? Adding nutrients to our food.
Yeah, it sounds good in theory. But the types of nutrients they're adding aren't always the best. Dr. Berg gets into the details and says that the types of iron and folate they use aren't actually doing us any favors.
So it's not just about adding stuff, but making sure those nutrients are in a form our bodies can actually use.
Exactly. He specifically talks about synthetic folic acid, which a lot of people have trouble processing, and says we should use folate instead. He also recommends a different type of iron that our bodies can absorb better.
So even something that seems healthy, like adding nutrients, can have downsides if it's not done right.
It just goes to show how complex nutrition is and how even things that are supposed to be good can backfire if we don't pay attention.
Okay, so we've covered a lot: institutional food subsidies, the GRAS loophole, and food fortification. But Dr. Berg doesn't stop there. He goes on to talk about some even bigger issues like medical research funding and what he calls the FDA revolving door. And trust me, this is where it gets really interesting. But we'll have to dive into that after a quick break.
You know, when you think about medical research, you kind of think it's this pure search for knowledge.
Yeah.
But Dr. Berg wants us to look a little deeper. He points out some things that might be conflicts of interest.
You mean the funding, right? He said the government spends like $40 billion every year on medical research, which sounds awesome. But then he explained how universities can patent drug discoveries and give exclusive rights to pharmaceutical companies.
Right, and those companies pay royalties back to the universities, and sometimes even to the researchers themselves. So it's like there's this system where money could influence what research gets done.
So it's not just scientists trying to cure diseases. There might be other reasons.
It's more complicated than that. I mean, Dr. Berg isn't saying all research is bad, but he wants us to know that there could be bias. He also says that those agreements between universities and companies are usually secret. So it makes you wonder, what are they hiding?
It's like those secret deals in the movies, except this is real life and it could be affecting our health.
Exactly. And it's not just about the money either. Dr. Berg also talks about what he calls the FDA revolving door.
Okay, what's that?
Well, it's this thing where people who work for the FDA often end up working for the companies they used to regulate.
Oh, so someone who was in charge of approving drugs at the FDA might later work for a drug company.
Exactly. It makes you wonder if they might be more likely to approve certain drugs if they're thinking about getting a job with that company later.
It's like a conflict of interest, right? It makes you question the whole thing.
It definitely shows how there could be bias. Dr. Berg even says that 9 out of 20 people who helped make the dietary guidelines had potential conflicts of interest.
9 out of 20. That's almost half. Is there a way to find out more about these conflicts of interest?
Yeah, Dr. Berg mentions this website called U.S. Right to Know. They use the Freedom of Information Act to get documents that show these connections. It's a good place to start if you want to learn more.
That's good to know. Thanks. So we've got medical research funding and the FDA revolving door. What else is Dr. Berg talking about?
Well, he gets into some of the ways food labels can be misleading. For example, he talks about this thing called the rounding rule, where companies can round down certain amounts of ingredients.
Hold on. So if something has less than 5 milligrams of sodium, they can just say it has 0.
Yep. And it might not seem like a big deal, but it can add up, especially if you're trying to avoid certain ingredients.
That's messed up. It's like they're trying to trick you into thinking it's healthier than it is.
It definitely makes you question how honest they're being.
Yeah.
And that's just one example of how they can make food labels look better than they really are.
So what does Dr. Berg think we should be doing to make healthier choices? Is there a way to cut through all the BS?
He talks about what he calls the big 3 of junk food: refined, sugar-refined starches, and refined oils. He thinks these 3 things are the main problem with most processed foods.
So it's not about avoiding certain brands, it's about looking at the ingredients themselves.
Exactly. And he even suggests putting warning labels on products that have these ingredients, just like they do with cigarettes.
Wow, warning labels on junk food. That's a pretty big idea.
It is, but it fits with this whole message of making sure people know what they're putting in their bodies.
I see how that would help. It would be easier to see what's really unhealthy. And maybe it would even make companies change their products if they knew people were paying attention to those ingredients.
Exactly. It's about making a system that helps people make healthy choices instead of making it harder.
Okay, so we've been talking about adults, but Dr. Berg also talks about how important nutrition is for babies and even pets.
Right. He says that a lot of infant formula and pet food has the same junk food ingredients we've been talking about. He thinks we need to have higher standards for these companies, especially since babies and pets are more sensitive to these ingredients.
It's like we're setting them up for health problems from the start.
It's something to think about for sure. And it shows how we need to be careful about what we're feeding everyone, even our pets.
Speaking of starting early, Dr. Berg also has some strong opinions about how much vitamin D we should be getting.
Oh, yeah. He's definitely not afraid to say what he thinks about that. He basically says the recommended daily intake of 600 IU is way too low.
Yeah, he said something about 8,000 IU being better. That's a big difference. Why does he think that?
He talks about a lot of research that shows that not having enough vitamin D can cause all sorts of problems, from a weaker immune system to a higher risk of chronic diseases. He even says that if everyone took enough vitamin D, we could see a lot less disease and lower healthcare costs.
That makes sense. I know a lot of people don't get enough vitamin D, especially if they live in places where it's cold and they don't get much sun.
It's definitely something to consider. And it goes back to what he said about being proactive about our health instead of waiting until something goes wrong.
Okay, so let's recap. We've talked about institutional food subsidies, the GRAS, loophole medical research funding the FDA revolving door, tricky food labels, the big three of junk food, infant formula, pet food, and now vitamin D. Dr. Berg covered a lot in this video.
He did. And even though some of his ideas might seem controversial, they all come from a good place. He really cares about making our country healthier and wants us to have a system that actually puts our well-being first.
It's like he's challenging us, right? To rethink how we see healthcare, to move away from just managing diseases and focus on actually creating health.
Exactly. It's not about treating symptoms. It's about getting to the root of the problem and giving people the tools to take care of themselves.
It really makes you think about how different things could be if we focused on preventing disease and making a healthier world for everyone.
Yeah. What if instead of waiting for people to get sick, we put money into things that make people healthy? Like healthy food, safe and affordable housing, clean air and water.
And education. We need to teach people how to make healthy choices for themselves and their families.
For sure. It's about giving people the power, not just telling them what to do.
Which brings us back to RFK Jr. and him maybe being the next HHS secretary. It's clear that Dr. Berg's ideas are similar to some of the things RFK Jr. has talked about, especially when it comes to fighting chronic disease.
It's going to be interesting to see what happens. If RFK Jr. gets the job, it could be a big change for the agency and for the whole country.
One thing's for sure, it wouldn't be boring. Dr. Berg's video definitely gave us a lot to think about. We've talked about everything from what we eat to how medical research gets funded to the benefits of vitamin D.
It's been a wild ride through the U.S. healthcare system.
Yeah.
We've seen some of the problems and thought about different ways to do things.
So what does all this mean for you, the listener? We hope this deep dive made you curious and maybe even a little skeptical. We want you to learn more about these things. Look into the resources Dr. Berg mentioned, and most importantly, start asking questions.
Because at the end of the day, your health is your responsibility. The more you know, the better you'll be at making choices that keep you healthy.
If you could make just one of Dr. Berg's suggestions happen, which one would you choose and why? That's something to think about as you keep learning about this complicated and always changing world of healthcare. Thanks for joining us on this deep dive, and until next time, stay curious.
Yeah, it really makes you think, how different would things be if we actually put prevention first and tried to make a healthier world for everybody?
It's a cool thought, right? What if instead of just waiting for people to get sick, we focused on the things we know make people healthy, like access to good food, affordable and safe housing, clean air and water?
Yeah, all that stuff.
And don't forget education, like actually teaching people how to make good choices for themselves and their families.
Totally. It's about empowering people, not just telling them what to do.
Which brings us back to RFK Jr. and, him maybe becoming the next HHS secretary. It's obvious that Dr. Berg's ideas kind of match up with what RFK Jr. has talked about, especially when it comes to, reducing chronic disease.
Yeah, it'll be interesting to see what happens. If RFK Jr. actually gets appointed, it could be a huge turning point for the agency and for the whole country.
One thing's for sure, it wouldn't be boring. Dr. Berg's video really gave us a lot to think about. I mean, we covered everything from the food we eat to how medical research gets its money to vitamin D.
It's been like a crash course in the U.S. healthcare system. We saw some of the problems and brainstormed some different ways to do things.
So what does all this mean for you, dear listener? We hope this deep dive got you thinking and maybe even a little skeptical. We really want you to look into these topics more. Check out those resources Dr. Berg mentioned, and most importantly, start asking questions.
Because at the end of the day, your health is in your hands. The more you know, the better you can take care of yourself.
So if you had the power to make just one of Dr. Berg's suggestions a reality, which one would you pick and why? That's something to think about as you keep learning about this crazy world of healthcare. Thanks for joining us on this deep dive, and until next time, stay curious.